If you're ready to live your life free from glasses and contacts, you've probably decided that laser eye surgery is the best option for you.
Only knowing which procedure is the best for you can be a bit more difficult. Those who have chosen laser eye surgery find themselves weighing the three best options: SMILE, LASIK, or PRK surgery. Brittany Kay recently sat down with Dr. Vance Thompson of Vance Thompson Vision to find out more about how each procedure is different and what the advantages are of each of them.
Thanks so much, Dr. Vance, for having us out here today.
Thank you, Brittany.
So first, I just want to talk about, we're going to go through PRK and SMILE. So just first start off by explaining what SMILE is.
Well, remember, the eye has focusing elements, the cornea, the front window, and then right behind the pupil is the lens. And they focus light onto the retina and the back of the eye, almost like a camera. But the cornea makes up 75% of the focusing power of the eye. And so we can change its curvature so someone is born with, you know, the corneal curvature that they would be able to see good without glasses or be born with great vision. And you do that through laser vision correction. And LASIK is what everybody's heard of, but there's also PRK and SMILE. And we tell people you want to do your research before you do laser vision.
Okay, so tell us the difference between PRK and SMILE.
Yeah. Well, PRK is where we laser just the surface of the cornea. And remember, LASIK is where we make a flap in laser. The LASIK uses two different lasers, one called a femtosecond laser, one called an excimer laser. And for years, we've watched the flap be made thinking, couldn't that flap maker just do the whole correction? Rather than just do the flap, while it's going through, do the correction. And Zeiss was the first company there in Germany to figure out how to do that, so that you kind of get some of the advantages of PRK combined with the advantages of LASIK in this procedure called SMILE.
So what is Vance Thompson Vision's experience with PRK and SMILE?
Well, we had the honor of being in the FDA-monitored studies for PRK, so the beginning of laser vision correction, and that's what led to us being asked to be in the beginning of LASIK in the FDA-monitored trials. And we're one of the few centers that was involved in the beginning of PRK, LASIK, and SMILE. So we basically have grown up with all three procedures. And when someone comes in for an evaluation, we do a good exam and give them our thoughts on all three so that they know they're, really becoming knowledgeable about the three most common ways to correct vision in the world.
So what are the advantages for using SMILE? First go through SMILE, then we'll go through PRK.
Okay, so let's say someone is a professional athlete. Sometimes they worry with LASIK that they could move the flap, or let's say they were in law enforcement and early on they took a punch. To tell you the truth, it would be hard to move a flap, but we do think about that, especially in that first couple weeks. With PRK and SMILE, you don't have to worry about that. So people who have a job that may have some trauma. And then the other thing is that lower corrections, oftentimes PRK is just a wonderful option. Medium and higher corrections have a tendency to be more towards LASIK or SMILE. So occupation and level of correction.
So how do I know which one is best for me? PRK, SMILE, regular LASIK vision correction?
Well, when you come in for the consult, we do what's called a topography. Just like we can look at the Earth's surface and what's flat and what's curved, we can also look at the cornea, the thickness. But that topography and that thickness in combination with your correction are what help us decide which is best for you.
So what are some questions I should be ready to answer when I come in to kind of decipher this? Because maybe I'm really unsure.
Right. I think it's always good to know what your lifestyle is like, your hobbies and your job. What your expectations for vision return. If we have someone that's going to be flying jets in Afghanistan in a week, they oftentimes are going to do a procedure where the vision is going to heal and be sharp real fast. If we have someone who has a little time for healing, oftentimes that doesn't matter, and they're a candidate for all three. So occupation, how quick the vision needs to be returning, the thickness of the cornea, the topography, and level of correction, and that helps us give you a recommendation.
So why is it so important for Vance Thompson Vision to offer both PRK and SMILE?
Well, you know, let's say that someone has a cornea that's not very thick. You don't want to do a flap first or a SMILE because they might not have a thick enough cornea. A thin cornea oftentimes is better with PRK. But PRK's vision return is just a little slower. And so sometimes occupationally people can't wait. And then we would then lean towards LASIK. But if they were in law enforcement and they were a better candidate for LASIK, it's probably better to do SMILE because they don't have to worry about the flap. And so there's all these things where you really want to just be going to a center that's well versed in all three, so they do what's best for you and not just the procedure that they do. For instance, you know, I like to say, even though we help develop LASIK, we're not a LASIK center. We are a center that is going to stay well versed in all the types of vision correction and do what's best for your eyes.
So speaking of that, Vance Thompson is always at the forefront for emerging technology. Do you see anything new happening when it comes to LASIK and the different ways for doing this?
Well, you know, in the world of laser vision correction, it really has been defined. There's not really anything new to correct nearsightedness and astigmatism. But let's say it's someone that's getting to that cataract age where they're also wearing glasses. There's some amazing advanced implants that help them, after cataract surgery, get clear vision and not need bifocals because they were able to restore their reading range of their 30s. And that's super exciting new stuff.
All right, well, thank you so much, Dr. Vance, for having us out here and telling us all about PRK and SMILE.
Yeah, thank you, Brittany.
Vance Thompson Vision is committed to continuing to provide the best care possible for their patients. This includes creating a safe environment. They have implemented multiple layers of safety precautions that start even before you arrive at their office with pre-screening phone calls to all patients. If you'd like to schedule a consultation with any one of the experts at Vance Thompson Vision to talk about which vision correction surgery is the best option for you, give them a call in Sioux Falls at 605-361-3937. You can also find out more by visiting VanceThompsonVision.com.